Guys, welcome back to Medical Coding with Blue. Today's episode is all about realistic salary expectations, non-money talk, and benefits for new medical coders. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so let me say this first so that if you are sticking around because you want a dollar figure and I don't give it to you, I don't want you to be upset because you think that, oh, this message was not what I wanted to hear. Guys, I do not talk about money in specifics on my channel. I never have and I never will. The reason that I am like this is because there are many schools out there that are pushing this field that I love very much, health information, medical coding. They are pushing it on people because of the money. That's what they highlight. That's what they talk about. The money, the money, the money. There are some schools that tell people a ridiculously high starting salary. And this is what people get sold on. This is what people expect when they get out there in the real world after completing a 6-week course or after completing a 4-month course. And they expect all of this high salary when meanwhile, that's not even the case. That's not even realistic. You know, even if you weren't in this industry, that would not be realistic to think that. But there's a lot of people that think that because they believe what's put in front of them, the second it's put in front of them, they don't critically think. So again, I do not talk about money and specifics on this channel, but I do want to talk about some of the realistic things that you need to think about when you're thinking about entering this career field and all of these things. I had somebody the other night on my live that was talking about, well, Blue, I know you said not to look in the Facebook pages, but I saw this thing on Reddit, and they were talking about how new medical coders get paid very low, or how the medical coding wages are very low for even veteran coders. I'm going to talk about that. But the thing is, when you start listening to other people, and even after I have said on this channel, and this what surprised me the most was this person has watched my channel for a long time, and to hear my message and to hear the things that I say, and then to go and listen to somebody else and then come right back here and ask me the things that I say, which is the same, which is when you are starting brand new as a new medical coder, there is the Department of Labor and the Bureau of Statistics. Both of these organizations list the entry-level starting salary for somebody in medical coding or in health information. So by all means, you need to do your research and go and plug in your zip code or plug in your state and find out what that starting salary is. And for some people may see a certain dollar figure as a really good starting salary. And then there are other people that turn their nose up because, oh, well, they have a degree and they have this and they have that kind of experience. When you're getting into this field, everybody starts off at the bottom. Everybody does, okay? It doesn't matter if you've been a nurse or somebody else in healthcare and you go over to the coding side. You are going to start at new medical coder starting salary rate. That's what you're going to start out at. But the good news is, and hopefully you haven't tuned out just yet, the good news is that you're not going to stay at that salary for very long. This is just to get you in. This is just so that the employer can pay you fairly for the skills that you do have in this industry, which when you are brand new is not very much. And for a lot of people, they go through these fast-paced medical coding programs because, oh yes, we can get you on your way to being this high-paid medical coder. And then when you get out in the real world, you realize you don't know a hill of beans because you haven't been studying. And guys, before you ask me, all of the recommended resources are in the description box below. Anybody who asks me, I'm going to delete that comment. Guys, because I don't have time, no one has the time to sit here and keep explaining it when it's there. All of the information is there for you. You just have to get used to doing your research, and you have to get used to, okay, I've got to look here and I've got to, do all of these things. That's what you have to get used to, because that's what this industry is based on, is doing your own research. Not everybody will give you the answers. But the thing is, if you are getting into this career field because you want to make a really high starting salary, you're going to be let down. However, if you are patient, which a lot of people lack patience nowadays, I hate to say it, but they do. But if you have a little bit of patience and you do the work, you learn and you practice and you get better and you expand your knowledge, that's when the money starts to flow. Because let me give you all the example of myself. When I first started, I said, okay, this was a 3-month assignment that I had gotten through a temp agency. When I had started there, I thought it was a great starting salary. I said, this is a wonderful starting salary. I'm happy with this, because I did see other places that were paying way less. And I was like, no, I don't think so, because I knew what the average starting salary was, and I was not going to accept anything lower than that. So when I got my first job and I got this good starting salary to me, because this was brand new to me, I went ahead and I worked those 3 months. Well, at the end of the 3 months, they said they were going to pick people, one person to stay, because there was 3 of us that were there at the same time. And I didn't get picked, and it wasn't on technical ability. It was just a supervisor. But that aside, I got another coding assignment, and that coding assignment really jumped up my pay. Not just by a few dollars, it jumped up my pay. So I was like, oh, okay. Well, I will go ahead and do this job, and I will learn it, and I will do everything I can to get really good at coding. Because that's when I started to notice that the more knowledge you have, the more salary you can command. So with that, I stayed there for another 8 months at my second job. And then I started applying for jobs that were closer to my hometown. And I got here to my forever home. Well, here at my forever home, I got another jump in pay. So again, because I'm not concentrating on the money always followed me. And it got progressively better each and every single time. And then a few years later, when I got a job working for a level 1 trauma hospital remotely, my salary really jumped. And not only that, I got bonuses on top of it. So because of performance, either productivity and accuracy, or a combination of both, if I had met those metrics. So that's something that you have to realize, guys. It's not where you're just going to come in, you're going to make these high figures, and then you're just going to do, push through the codes and things like that. It's not like that. And if you think that, which a lot of people do, then that's when you're going to find yourself, disillusioned. And then you're going to be on places like Reddit or Facebook or Instagram or Snapchat. I don't know, TikTok. I don't care. Any one of those, it doesn't matter where the information is coming from. Those people have an unrealistic expectation of what salary should be like. And if you are researching this field, if you are looking at something like salary, you haven't even started studying medical coding just yet, but you are wanting to make sure that that salary is in line with what you want to make. It should go without saying that medical coders do make really good money, okay? So that should be put aside. But the fact that you're concentrating on the money part before you even get into the school, this field is not for you then, most likely. Because people who get into this field have to have patience. They have to have the ability to research. They have to have the ability to be able to build and expand their knowledge base. Because again, friends, that's what's going to get you more money. That's what got me more money when I worked at home remotely for the level 1 trauma hospital, because you can't be lacking in knowledge to work for a level 1 trauma hospital. Level 1 traumas are the ones that they're coming in, they have all of these gnarly accidents and everything, and you're having to code. And these are not just your like laparoscopy codes, you know what I mean? Like these are not just simple appendectomy and, tonsillectomy. No, these are repairs. These are, open reduction, internal fixation. These are all kinds of repair codes. And these are when you get a little bit more in depth into that knowledge. But again, being able to have that experience and build on that, I can command higher levels of pay because of it. I've been a medical coder for 16 years. My pay has always progressively gotten better. And for those of you who say, well, I'm a veteran coder and coding just doesn't pay enough, then you are at the wrong place. You are at the wrong place. People who whine and complain, and yes, I'm going to call you out for whining and complaining about working in a place that pays low. There's lots of medical coding jobs, and especially when you do get experience, it's all about how your resume looks, how you're putting your skills on there so that you can get right to the point, so that that employer can look at your resume and say, okay, this person knows what they're doing. Let's go ahead and call them in. When I applied for that level 1 trauma hospital, I knew exactly where I wanted to go. I knew exactly the job that I wanted. And as soon as I put in my resume with them, it was a very short amount of time. I think it was within 2 days. She had called me for an interview because she was going through resumes, and she saw mine. She said, your resume is real good. And I had a few years at that time of coding experience. So that goes to show you, when you know how to talk about your skills, because they don't know you from Sue, Jane, or Sally, and you know how to talk about your skills and you can get right to the point, that's when you get better results. So if you are a veteran coder who's complaining that you're going to leave because it's not paying you enough, then you obviously have not worked on your skill set to be able to expand it. Maybe you stayed in just one particular specialty. Maybe it's PT and OT. The thing about PT and OT is that the CPT codes that are for that section are very limited. Yes, you do see a lot of injuries and things like that, musculoskeletal conditions and things. But with those, again, you're kind of singling out your experience there with those CPT code sets. So you need to be in a place that's going to give you an expanded variety of practice, which is evaluation and management, CPT code, and of course HCPCS. And if you're on that inpatient side, again, if you're on inpatient side, there should be no reason that you're saying that you get low salary. Nobody gets paid low salary in inpatient, okay? Nobody. But you have to know a lot. You have to understand pathophysiology. You have to understand about DRGs. You have to understand about sequencing. You got to be real good with that sequencing, because if you're not on that inpatient side, you can affect the amount of money that's coming in from that facility, right? Because the DRGs, when you're assigning DRGs, it's going to give a different amount of money based on that DRG. So that's the thing. If you're not sequencing it correctly, you could cost that facility thousands of dollars. And those thousands end up into millions after a while. So that's something that, again, if you're not bettering your skill set and you're just complaining that you don't get paid enough, why aren't you looking for another job? As easily as you were able to get that job, you can get another job. And for those of you who say, well, I'm just concerned about the benefits and everything. So if you are at a place and maybe they have good benefits, then you have a decision to make. If you want to leave those benefits and go someplace else. But if you choose to stay there, then you can't really complain anymore, right? So you should stop making those posts all over Reddit and discouraging people because you're not telling the full side of the story, right? Okay, I want you guys to understand these things. And yes, I'm going to be blunt. It doesn't matter, guys. It does not matter why you want this really high salary right out of the gate. If you pay attention, if you do the work, if you apply yourself, you will be able to build your skill. Then you will be able to apply for places that are asking for people who have this sort of specialty knowledge and that kind of thing. And if you come in with really good of that specialty knowledge, that's when you could start making more money. And if that place is not paying you what you think that you should be paid, then you need to move on. A viewer from my channel a few years ago was going through this. A very young fella started out in his first job, stayed there for 2 years, but complained that he wasn't getting paid enough. So I encouraged him to go and look for other employment. He got another job, and that paid him even more money than what he was making. Then at that job, he was there for 6 months, wasn't satisfied. And he asked me again, what should he do? I said, keep applying. If you're not satisfied, if this is not where you want to be, then you go and you apply for another job, because apparently you have a really great skill set and you have a lot of knowledge. So with that, he went and I helped him with his resume. He went and applied for another job, and he got an even better job with more money. So don't stay where you are if you think that salary's too low, okay? And if you're new and you're just starting, then you have to be willing to accept, hey, is this a really good opportunity? Are they going to help me here to learn? Because book coding and real world coding are two different things, guys. And if you are at your first job and saying, okay, well, yes, I can do this. This sounds like a good idea. I'm going to stay with this for a little bit, maybe 6 months, maybe a year, and then I'm going to continue to apply elsewhere once I start building my knowledge. That's okay. These companies are companies. They will survive without you, okay? So that's the thing that you have to understand. When it comes to these jobs and it comes to your career, if you're not comfortable at that place, or if you're not making enough, then you need to move on, and you need to do that. You need to start networking. Networking is another great way to ensure that you're getting the kind of salary that you want, or maybe that you're going to be able to work in a place that's comfortable for you. Okay, this stuff is not hard, guys. When it comes to salary, it is not difficult. If you are not being paid enough, you need to move on. And move on to another coding position. Apply with other places. But again, if you stay there, do you really have a right to complain? No. You have no right to complain if you stay. Because that's you're wanting to do that, and that's a choice. That is a choice to stay. Okay? I've had many people who write me and who say, well, Blue, I have all of these years and I just don't know if I should leave. Well, if you really want those benefits and you stay, then why are you asking me? Don't ask me, because you've already made your decision. I'm not going to sit here and sell the field. I'm not going to sit here and sell the salary of the field. I will only say that it pays very well and everybody knows it. And again, if you are not being paid well, then that is not the place for you. Sometimes when coders work for private doctor's offices, which I always recommend not doing, then they're some of the ones that complain the loudest about it doesn't pay enough, because not only are they doing the coding, they're also doing the front desk check-in, they're doing, prior authorizations, they're doing all of these other things, release of information. They're doing many hats, because that single doctor's office is trying to squeeze as much labor out of that person as they could possibly get. Of course, you're going to feel overrun with, duties and things like that. And, when you could just be coding. So if you apply for hospital organizations or other government healthcare facilities, you would be able to have better opportunities, because then you start doing just the coding or just the billing. For me, I am just a coder, as far as that is my job title, that I am a medical coder. However, my other hats are, clinical documentation improvement and working with my providers and educating providers. And I also educate medical coders as well. So that is other hats, but that's related to what I'm doing. That's not a part of my daily duties. I don't have to call patients. I don't check anybody in. I don't call and do appointment reminders. I don't do any of that, because my main focus is doing the coding. And you can do that too. And where you start is not where you have to stay. Because if you think that, again, you're being very small-minded. You don't have to stay there. You don't have to be, oh, well, I want to be loyal to this. Why? Are they going to be loyal to you? If something was to happen to you the next day after you get started, your job would be posted in the job banks the very next day. Let's be honest. Let's be honest. So you have to go where it is best for you. Learn what you can at these places that you work. Take that knowledge and move on to the next place. When I worked at my first place, it was a cancer therapy research center. I learned all about neoplasms. My second place was learning to code for professional fee coding. I had never done professional fee coding, as far as where the patient is inpatient in a bed in a hospital, and the provider comes up and they do their rounds on that patient, and I make sure that that provider gets paid for their professional fee service. And I had never done that. Okay, you don't do that at the Cancer Therapy Research Center. That's an outpatient clinic, right? And so then I took that inpatient professional service knowledge to my forever home. And that was my first place that I worked when I worked here. That was the first clinic that I had. Clinic, it's not clinic, but it's the specialty that I was in. So that was the first thing that I did when I was here. Then I moved on to behavioral health, and then I moved on to TBI, and then I did, I did urology. I did all I did everything. Orthopedics, podiatry, which is what I do now, orthopedics and podiatry. But I did neurology, I did rheumatology, I did a lot. You know, pulmonology was another one too. So there's a lot of different specialties that I've done, and that's not all of them. That's just the ones I could think off the top of my head. ER, I've done that too. But same day surgeries. So there's a lot of moving around. That tells me that if anything happens, heaven forbid, with my facility, I could go anywhere. I could go anywhere and work anywhere and command a really good salary because of my knowledge. And it's all about accuracy. It's all about knowledge. It's all about what you can bring that facility and what you are starting out with. And I will tell y'all the story of the nurse who said she was in nursing. She wanted to get out of the bedside. She had to get out of the bedside. So she went through my independent study. My independent studies, the link is in the description box below. It's got all of the, it's got all of the books and the syllabus broken down. And she followed it to the letter. She got her medical coding certification. Then she worked as a medical coder for a while. She said that she took a step back in her pay, but she looked at that as paid training. And then, lo and behold, within 2 years, she got her CDIP, right? But she got that, and she was able to get her get into CDI that she wanted to get into, and now she makes more money than she made as a nurse. She makes more money now because she was patient and she went through it. She took a step back in salary, but she was able to handle it because she looked at it as paid training. And then she was able to move forward into her CDI position, and she makes more money now than she did as a nurse. And can you imagine if she would have turned her nose up at that starting salary as a medical coder? Can you imagine what she would have lost out on? And the opportunities, the benefits of being in this industry. We get educated. There's tons of free education out there, and it just takes a little bit of effort. And sometimes your employer will pay for you to go to things like conference, or pay for you to take additional classes and courses and things like that to kind of help you to learn more. And if you are applying yourself, if you are still studying medical terminology on your own and anatomy on your own, looking through these YouTube videos on anatomy and medical terminology, you'll get better. You'll get faster with time because your critical thinking will start to build and your skill set in coding will start to build. And again, that's what makes you command a higher salary. So if you're going to let the starting salary run you off, this field is probably not for you because you're not patient enough and you clearly only want to look at the money. When you chase the money, you will be miserable. You will be miserable. But if you don't chase the money and you're just looking at, gosh, I've just got to be able to catch up. I've got to be able to learn what I have to do in order to succeed in this field. That's when you'll start to see the money follow you. Because then you'll start to get into these positions where, you know, they do offer bonuses and things like that. You know, not every place offers bonuses, but it really all depends on where you're working too. Okay, so again, if you are working in a place that they're not compensating you fairly, or they're compensating you under market value, then, and you can find that out by going to the Department of Labor or the Bureau of Statistics, and you can take your skills and go apply at other places. Other places will pay you more if you let them know what you're there for and what your skill set is and all of these things. If you can do that, you will start to see the opportunities there for you. But if you're going to sit here and waste your time in Reddit, Facebook, TikTok, Instagram, YouTube, whoever, right? Whoever is saying all these negative things. If you want to waste your time on those platforms, then you're going to continue to waste your time on those platforms, because those people have other things going on that has nothing to do with you. Okay? And people who may be saying, well, I don't get paid enough. They may have a really high salary and they're still saying that for the things that they do. I'm just saying. With that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.